Okay, so let's talk about myelophthisic anemia. Myelophthisic anemia is a name for anemia that is caused by something that infiltrates the bone marrow, therefore doesn't let the normal red blood cells, white blood cells, platelets to develop, namely infiltrates the bone marrow. So you can see many photos here, and I will try to explain why we see what we see. So in myelophthisic anemia, it can be primary, namely there is a genetic disorder that causes this proliferation of something in the bone marrow. It can be in myeloproliferative disorder, secondary to myeloproliferative disorder like polycythemia vera, essential thrombocytosis. Those infiltrate the bone marrow and can, I don't know, occupy the place and doesn't let other uh, blood cells to develop. It can also be primary myelofibrosis, and fibrosis occupy the bone marrow and destroy other cells. It can also be secondary to other things, especially or mainly to metastasis of cancer. So cancer that goes to the bone marrow, infiltrate the bone marrow and destroy all of that, all of the bone marrow, and therefore we don't have blood cells and the bone marrow is destroyed. So sometimes when we look at the blood smear, the peripheral blood smear, we can see young cells from the bone marrow, like white blood cells, red blood cells, and this is called leukoerythroblastosis. You can see here a blast, which is a young shape of a blood cells. Anisocytosis, which means that there is a difference in the size of the blood cells, and poikilocytosis, which means that there is different in the shape of the blood cells. Teardrop cells, nucleated red blood cells are usually young shapes of red blood cells. Um, this is the smear you can see. So the diagnosis is using this peripheral blood smear to see these changes. You can see the bone marrow that is occupied if you do a bone marrow test. You can see the leukoerythroblast in the peripheral blood smear. Um, and you can sometimes do genetic tests for things like myelofibrosis. You can look for the underlying cause if there is a metastatic disease. So for the cancer, you can look for myeloproliferative disorder that can cause it, like polycythemia vera, essential thrombocytosis, myelofibrosis. You can look for the genetic causes of the myeloproliferative disorder, like JAK2, like other genetic tests, CAR-PL or MPL, the genetic test for myeloproliferative disorders. And about the treatment, it can be transfusion if there is a very severe anemia. For primary myelofibrosis, bone marrow transplant, and treating the underlying cause if the underlying cause is known. For example, the cancer. If we can treat the cancer, the metastatic disease, so we can treat the underlying cause. So looking for the underlying cause if there is an underlying cause, because it can be primary or secondary. Treating the underlying cause, if it is found, uh, of course, might help. So this is the infiltrative disease of myelophthisic anemia that cause anemia. Thank you very much. If there are any mistakes or any something else that you want to say, please tell me. And this is it.